Dr. Matkey says it's also important for adults who are around young children to get vaccinated for flu to help protect children too young to get the vaccine and those who are not eligible. So let's continue this conversation with our trusted pediatrician, Dr. Keith Watson from West Point. Good to have you here. We talked about flu the last time because we were seeing the numbers going up, not just in schools, but workplaces everywhere. So RSV, which is as serious and can be more serious, especially in children, the numbers there are also rising.
Yes, this is definitively a winter virus season. Flu hit very early, and RSV has as well.
So talk to us about the difference between flu and RSV.
Well, they're both respiratory viruses. So, you know, the old adage for a virus, there's no cure. You get it, you've got it,
right,
until it runs its course. RSV is a little bit different in that it attacks more your lower respiratory system. So young children with RSV often have lung involvement. Flu in and of itself is upper respiratory symptoms, the cough, the congestion, the snotty nose. You do get those symptoms with RSV, but many children also get lung involvement as well, which then leads to, as the piece suggested, respiratory problems, difficulty breathing, low oxygen levels, that kind of thing.
We often hear RSV specifically associated with young children. Why are they so susceptible to it?
Because they are smaller, because their airways are smaller, and because it affects the lungs.
Okay.
It causes people with smaller airways and smaller respiratory symptoms more distress. So the younger the child with RSV, the risk for more serious infection.
Oftentimes, children who are diagnosed with RSV do end up in the hospital. Why the hospitalization? Like, why can't you just treat it at home?
For most, you can. But if it gets into the lungs and they have respiratory compromise, because there is no medicine that treats RSV, the treatment is just symptom care. Children that end up in the hospital are usually there because they're having breathing difficulties, so they're in the hospital getting oxygen.
All right, the piece suggests, I mean, there's no vaccine for RSV. There's one in the works, as I understand it.
Currently, there's no vaccine for RSV like there is for the flu. There is an injection called Synagis, and Synagis is an immunization, if you will, for premature infants who are at risk for getting RSV.
Okay.
But it's only in select cases. It is not a universal injection for all people.
So really there's nothing, I guess, preventative that you can do to keep your child safe from RSV, aside from just the normal precautions that you would take.
Right. You're exactly right. It is just, other than the vaccine for flu, which we have, the prevention of these illnesses is avoidance and hygiene.
Avoidance and washing those hands, you know, we can't preach that enough. Also, you know, if your child cannot get the flu, too young for the flu, I'm sure you encourage parents, you get vaccinated so you keep yourself safe and you don't pass it along to them.
Absolutely. Parents, older siblings who are in school, any case like that, you get the vaccine. Yes, it's to protect you from the flu, but it also can prevent you passing it to a high-risk individual, such as a young child, which is my world, or even elderly people who have ongoing chronic health problems. It prevents passage of those illnesses.
There's nothing scarier than a sick baby. At what point do you seek medical care? You know, when the coughing and the congestion has really gotten to a point maybe where the breathing is being affected?
Difficulties breathing more rapid, breathing more shallow, any color changes if your child appears blue or pale, and then complications if they're breathing rapidly and they don't take in enough fluids, then they can become dehydrated. So decrease in intake of fluids, decreased urine production can be a sign of dehydration. Okay. But significant obvious respiratory symptoms are the key to have your pediatrician or an emergency room look at your child.
Sometimes that ER visit is, you just have to do it.
Sometimes you have to.
All right, Dr. Watson, we appreciate it. Thanks so much.
You're welcome.
All right, everybody stay well. A new